Tell us the information that was published in 1959 showing that if you grew up in Japan, you have a cholesterol of 120 and you almost never see a heart attack. If you move to Hawaii, your cholesterol rises to 180 and your heart attack risk triples. You then move to Los Angeles, your cholesterol is now 210 and you have 10 times the heart attack risk that you had when you lived in Japan.
Yeah, there's some really cool observational data. It's not perfect data. It's not the ultimate randomized data that leads us to believe that our genetic background matters, but our lifestyle, our community, our friends, our family, our surrounding has a bigger impact on our health or our disease. And one of these is called the Ni-Hon-San study. Relatively new to me, I've heard of it. It gets credited to, in part, Dr. Ansel Keys, one of the major researchers over the decades looking at the epidemiology, why we get heart disease. And he basically had it set up that there were native Japanese residents who were evaluated for health, cholesterol, blood pressure. A good portion of the population moved to Honolulu. There were cultural changes, diet changes, community changes. They had assessments of their health. And then they ultimately identified a group of the Japanese that had moved to San Francisco, why it's called Ni-Hon-San, S-A-N for San Francisco. And it was a trend towards changes in diet, changes in stress, changes in sleep, changes in community, exposure to different kinds of restaurants and foods and grocery markets. And the cholesterol just went up and up from Japan to Hawaii to San Francisco. And ultimately, it takes a while. It takes at least 10 years, often 20, to see cancer and heart events start to show up on the radar screen. But all that followed, and it's pretty convincing data that you can create a really healthy environment, something often referred to, let's create a blue zones in our community or a blue zone in our house. And you can create an unhealthy environment, which is basically most of American culture. But it's, to me, really a great example to teach people, no matter what mom, dad, brother, sister had, and you should be aware and pay attention to that. What you do today, breakfast, lunch, dinner, gym, sleep, smoking, is by far the most important decision.
Is it true that the egg industry sponsored 92% of the egg studies since 1990?
There is a lot of money in the food industry, whether it's dairy, beef, pork, egg, and they have the ability to identify and fund researchers. Probably the best example that's been published by credible scientists was that in 2008 in Mexico City, the dairy industry got together and they had an international conference in response to a pushback that there were now dairy alternatives. Probably in 2008, it was mainly soy milk, maybe rice milk. Now there's 15 different plant-based milks. And the dairy industry actually published their notes of that meeting. That's why we know about it. I think it's in the Nutrition Action newsletter in 2014. But their published notes indicate that they were going to try and identify marketing strategies, sympathetic researchers, the ability to fund research to further prove the point in this case that dairy was healthy and to try and secure their sales in the United States around the world. And then we got the got milk and the chocolate milk and all the ads and actually published studies. They found researchers who were willing to do human research or database research and take funding. Of course, you're supposed to put at the end of the article that it was funded by industry. The egg industry, now to get directly to your question, is no different. They have the dollars, this national trade organization of egg producers. The cruelty of the egg industry is pretty well known out in the media. The debate about healthy, unhealthy is, in the public mind. And they have really flooded the research magazines with researchers that, whether they're of high integrity or not, but they're taking money from the egg industry. That statistic that the majority of the newly published studies on eggs have been funded by the egg industry is true. And it puts a bias where now you have to question the integrity of the scientist. Otherwise, you would have naturally thought that was assumed to be fairly high integrity. But it's hard to go back to your industry-funded research contact and say, our project was a failure. We can't support that eggs are healthy. If we publish this data, it's going to add to the very large data that eggs might contribute in an otherwise healthy diet to a rise in cholesterol or a rise in heart disease. That's an awkward situation. So even though it may be that they strive hard to avoid conflict, you're not going to get too much funding for the next project if you come up with negative data. Yes, it's a dirty, dirty kind of situation.
Do you recommend cholesterol-lowering drugs?
There's a big issue with atherosclerosis, hardening of the arteries, plaque in arteries. Cholesterol is not the only cause, but cholesterol in the blood is a cause. It's a risk factor. There's others like smoking, of course, diabetes. There's no dispute anymore in the medical world, even in the plant medical world, even in the integrated medical world, that the vast majority of the data is that a high blood cholesterol, particularly LDL cholesterol, causes atherosclerosis. It's not the only cause, but causes atherosclerosis. And beginning in 1994 with a big project called the 4S study, it was shown that agents, in this case it was a statin, simvastatin, the 4S study, not only lower the blood cholesterol, but lower the heart attack rate and actually lower all causes of death. Very convincing study in people who had already suffered one heart attack. And so many other studies have taken that very high-risk group, previous heart attack survivors, then looked at lower risk groups, and ultimately at people who've never had a heart attack. And that gets a little tougher to find. But the bottom line is some people can achieve a very optimal cholesterol with diet and fitness and stress management. And some people try very hard and they can't. And dependent on their gradient of risk, if they've had previous bypass, heart attack, stroke, stents, they need a very low LDL cholesterol, and they may need a medicine to get there. I sometimes use natural vitamins to get there, but it's still taking pills. It's not just plants. If people are at a lower spectrum of risk, and you can judge that very easily by certain heart testing and artery testing, then we should withhold a drug that isn't needed if you don't have a disease. Let's not treat you for it. But yes, these agents are always the first choice of a vast majority of doctors, where I would rather they tried lifestyle for 3 or 6 months in most situations and pull the drug out as the last resort. But we're not getting rid of them anytime soon.